Thank you, Patrick, and good afternoon. My name is Brian Peltz, and I'm an Area Vice President of Business Development at Tabula Rasa HealthCare. I'm excited to share Tabula Rasa's innovation in medication safety and how we have been able to redefine the approach to improve medication management. Let's put this into perspective for the Medicaid population. In fiscal year 2017, Medicaid spent approximately $64 billion on outpatient prescription drugs. There were 74 million Medicaid recipients in the United States. And as of fiscal year 2020, Medicaid total expenditures were more than $649 billion. The savings opportunities are enormous based on this published statistic that for every dollar we spend on prescription medication, we spend more than another dollar trying to address problems caused by normal medication use. At Tabula Rasa, we have demonstrated that these adverse events are predictable and preventable through our MedWise Science and patient engagement processes. Even if we can successfully address a small percentage of this opportunity, the millions of dollars can go a long way to improve reinvestment in other areas of need, like mental health, long-term support services, and home care-based services, in addition to improved health outcomes and quality of life. Actual experience in a Medicaid health plan with more than 88,000 members resulted in an average risk score reduction of 6.35 points. Of those members, approximately 22,000 qualified for a medication safety review that resulted in approximately 25,000 targeted interventions. A focused follow-up study of 200 of the highest risk enrollees from this population resulted in an overall healthcare savings of more than $1.1 million. The average cost on pharmaceutical spending in 2019, as reported by CMS, was $1,213 per member per year. For a modestly sized Medicaid health plan of 50,000 covered lives, this opportunity exceeds $60 million. And just for facts, as of 2020, Medicaid total expenditures exceeded $650 billion. Tabula Rasa uses a proprietary risk stratification process to determine a MedWise risk score for each population. Our risk score ranges from 1 to 50. Clinicians can then prioritize these risk scores to reach out to those with the highest risk of adverse drug events. We've identified those with the risk score of 20 or higher as high risk. From our years of research and analytics, we've compared these scores to patients' medical claims and continue to see that those with a score of 20 or higher tend to spend at least twice the annual medical spend compared with the average patient. A study published in May of last year indicated that a 1-point reduction in our risk score equated to about $1,000 for Medicare enrollees and $850 of additional medical spend for a Medicaid recipient. By reducing the risk score, we reduce cost. At Tabula Rasa HealthCare, our mission is to improve clinical outcomes, save patient lives, and reduce healthcare expenses associated with adverse drug events. Our science and technology is supported by Precision Pharmacotherapy Research and Development Institute located in Lake Nona, Florida. In 2020 alone, we published 47 peer-reviewed journal articles to support our science. Tabula Rasa currently serves over 1 million patients in the medication therapy management, PACE, and MedWise Science arenas. We are directly associated with a number of academic institutions. And we currently operate 8 call centers around the United States. And 4 of those are actually located, co-located at colleges of pharmacy. As I mentioned, our Precision Pharmacotherapy and Research Center publishes regularly and uses that research to improve and develop products that we bring to support our mission. Chronic conditions are on the rise, and medications treating them are responsible for a higher prevalence of adverse drug events. Said differently, as the number of people with chronic conditions continues to increase, so does the potential risk of an adverse drug event. Year over year, we've shown that for every dollar we spend on medications, we continue to see more than another dollar being spent to treat the unintended events that these drugs cause. As you can see from this slide, it's interesting to show that 59% of the emergency department visits are related to adverse drug events are associated with anticoagulants, diabetes agents, and opioids. These are very common classes of medications that many patients are taking on a daily basis. So there is certainly an opportunity here to assist with improving patient outcomes. Tabula Rasa's science and products are also aligned with strategic goals of Health and Human Services. Protecting the health of Americans, strengthening the economic and social well-being through improved outcomes, and avoidance of events that impact the quality of life. Advancing science through the development of evidence-based outcomes data. I recently attended the National Association of Medicaid Directors Conference in Washington, D.C., where Xavier Becerra and Chiquita Brooks LaSure presented on the goals and missions of Medicaid over the next year. Health equity and elimination of health disparities top the list, with the overarching goal of improving health and reducing the overall cost of care continue to be paramount. The pharmacist's role in identifying and reducing medication adverse events is a very important piece of achieving these goals. Maternal fetal health, relating to pre and postnatal care, social determinants of health, and a focus on home-based care services, mental health, access to care, and long-term support services were highlighted during that presentation. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences. As you can see in this definition provided by the Robert Woods Johnson Foundation, pharmacists can definitely play a role in improving health equity and delivering services to all individuals that they service. Through their medication and health expertise, pharmacists can provide chronic condition management, comprehensive medication management, and medication reconciliation and assessment. These are also very important steps in helping patients improve health equity, their overall health outcomes, and quality of life. Pharmacists, physicians, and other health professionals also play an important role in addressing social determinants of health and health disparities. Pharmacists have been addressing social determinants of health for years in all the populations that experience these disparities by working as vital members of their communities and interacting on a regular basis with patients. The case presented in this article highlights social determinants roles of health and how pharmacists contribute to improving them. From a Medicaid gap perspective, we are addressing the gaps of Medicaid through many legislative realms across the country. 37 states have enacted 83 bills related to utilization management tools in 2021. 21 states have enacted 31 bills related to formulary requirements, tier restrictions, coverage mandates. And 2 of those states have addressed polypharmacy and medication reconciliation directly, that being Connecticut and New Jersey. Other areas that are being focused on are insulin pricing, pharmacist administration of injectable drugs, and also areas revolving around the widespread use and legalization of cannabis, THC, and CBD products. 18 states have enacted 27 bills relating to pricing transparency, and 12 states have enacted 21 bills related to the electronic health records and electronic prescribing systems. So in our Medicaid space, you can see that there's much going on across the United States. A lot of it focused on pricing of medications and the delivery of services revolving around the medications. But it's encouraging to also see that some states are addressing the importance of improving adverse events and providing a medication risk reduction strategy to their populations. As an example, as states adopt that legislation, New Jersey has actually recently adopted legislation requiring that Medicaid recipients receive advanced medication risk reduction interventions as part of their benefit in order to improve the overall health of their population. And I think we'll see more states addressing those issues around outcomes and adverse drug events as we go forward into the future. Now I'd like to introduce our MedWise Science. Tabula Rasa has spent years developing solutions to address the issues of adverse drug events and mitigating risk to improve medication safety. By way of background, Tabula Rasa in Latin translates to blank slate. Our goal here at Tabula Rasa is to look at medication safety differently. Start with a blank slate and tackle this issue with innovative technology. We call this solution MedWise. When you think about the traditional model that is used today to approach adverse drug events, it's predominantly a one-to-one drug analysis that addresses 2 medications at a time. While this is sufficient for patients that are taking 2 or 3 medications, this analysis lacks the ability to aggregate adverse drug events, adverse drug event risk for complex regimens that may contain 5, 10, 15 or more medications. Our MedWise technology platform performs a simultaneous multi-drug assessment of the patients for aggregate risk for their adverse drug events. Our tools help to guide pharmacists, prescribers, and clinicians toward individual medication management in a very efficient and streamlined manner. When we are collecting and weighing the pharmacokinetic and pharmacodynamic impact, we take 5 areas into consideration to calculate what we call the MedWise risk score. These 5 factors are the data from the FDA adverse event reporting system. This score represents the overall odds ratio for an expected adverse drug event based on the FDA post-marketing surveillance reporting. We also look at cumulative anticholinergic and sedative burdens. On the chart on the right, you see examples of anticholinergic effects. This is important because a high anticholinergic burden is associated with GI dryness, as well as brain dryness, and can lead to significant cognitive impairment, especially in older adults. We also look at QT prolongation, which can lead to arrhythmias and even sudden death. Lastly, we consider competitive inhibition, which looks at the body's ability to metabolize multiple medications at the same time. Competitive inhibition is demonstrated here with the example of a parking lot. We know that approximately 80% of the medications that we take are metabolized via the CYP450 system. Substrates of the CYP450 system show varying degrees of affinity for the enzymes. Substrates are with greater affinities may cause competitive inhibition of the metabolism or activation of other substrates with lower affinities. An example that I like to use is shown here, where oxycodone and paroxetine are competing for a parking space in the CYP450 system. As you know, oxycodone has to go through first pass effect to become an active metabolite that actually provides pain relief. Paroxetine is a stronger substrate, which takes that parking space up first and prevents the oxycodone from being converted. This can cause effects with many different drugs, but in this case, it can cause a unwanted overdose situation. So the OxyContin concentration continues to grow in the bloodstream. Paroxetine continues to block it. And then for some reason, if the patient should stop taking the paroxetine, this higher level of oxycodone in the bloodstream becomes available for metabolism into the active metabolite and pain relieving form, which can then cause an overdose situation. We see in many cases where patients are complaining to their provider that they're not getting pain relief from the dose being prescribed. The provider increases the dose and increases the likelihood of that adverse drug event. Our science directly can look at that potential, identify when it is a likely cause of the patient's continued pain, and address that with the patient and the provider through several different mechanisms. By knowing this in the science, this is where we know that that the statement we make is true, that these adverse events are predictable and preventable. If we can identify the drugs that the patient is taking, we can prevent that event from happening. As we mentioned earlier in the presentation, we use a proprietary risk stratification process to determine a MedWise risk score. Our risk score ranges from 1 to 50, and clinicians can then prioritize these risk scores to reach out with individuals at the highest risk adverse drug events. We've identified those with a risk score of 20 or higher as being high risk. From our years of research and analytics, we've compared these scores to patients' medical claims and to continue to see that those with a score of 20 or higher tend to spend at least twice the annual medical cost compared to the average patient. Also, as you can see from this, a study published in May of last year indicated that a 1-point reduction in risk score equated to about an $850 reduction in medical spend for a Medicaid recipient. By reducing the risk score, we reduce the cost. The risk score is predictive of outcomes and costs for hospital admissions, outpatient visits, length of stay, and other unintended events. The higher the score, the poorer the outcome, and the higher the total cost of care. These results are taken from the CMS 2019 Enhanced MTM program year. This is a 5-year program that we'll talk a little bit more about as we go forward. It evaluates medication safety reviews rather than CMRs that are used in the traditional MTM process. And as you can see here, patients with a risk score of 10 as compared to patients with a risk score of 20, almost twice the spend. We see a higher number of average outpatient visits, hospital admissions, length of stay, adverse drug events, falls. It all adds up to a higher cost of care. In those with very high risk or scores over 30, we see almost a 2.5 time increase in cost over the average patient. The savings are real. The dollars are huge. A patient's individual medication data is used to generate the visuals that we can provide to clinicians to support these interventions. A very important part of the process that we use is medication reconciliation and understanding that patients have trusts in their pharmacist. When the pharmacists have the conversation, they engage the patient to identify those medications, which may go beyond what we see in claims. So patients that are taking nutraceuticals, vitamins, CBD and THC containing products, that information can all be gathered, entered into the software to generate a very visual tool for the pharmacist to begin the conversation of how they can improve that patient's outcomes and reduce their overall cost of care. As you can see from the example here, the medication risk score for a patient appears prominently at the top of the page after that is calculated. The risk scores, as we talked about earlier, so adverse events is related to the FDA adverse event reporting system, anticholinergic burden, sedative burden, long QT syndrome, and competitive inhibition are shown in what we call a bullseye. The patient score is represented by the blue center section, and those areas of the 5 components of risk that we're looking at that approach the red tell us that that's where the highest opportunity is, the highest risk that patient has. So in this example, clearly shows us that the risk is lower in competitive inhibition, adverse events, but very high in anticholinergic burden and sedative burden. This is caused by multiple meds that the patient may be taking that each have anticholinergic or sedative burden, and then they start to add up as each medication is added to the regimen. As we said earlier, this leads to the higher likelihood that the patient could have a cognitive impairment, which could lead to a fall, a hospitalization, and potential surgery. The windrows on the right is an example of that adverse event score from the FDA. So based on the meds that the patient's on, areas that we'd be identifying to look for an adverse event based on the likelihood as reported through the FDA. Each patient intervention is followed up with an easy to understand printed material that is given to the patient and is also shared with the provider. We make sure that the patients fully understand and buy into the recommendations that are being made. Our pharmacists are trained to focus on the ability of a patient to make the changes or the number of changes that could be required. In most cases, patients can handle 2 to 3 recommendations for change. And these may be anything from discontinuing a medication if it's a polypharmacy to taking medications at different times of day to minimize that competitive inhibition. About 40% of the recommendations that we make are adjusting the time of day so that 2 medications competing for metabolic sites in the liver are taken at different times to minimize that inhibition. Tabula Rasa HealthCare participated in the Enhanced Medication Therapy Management EMTM pilot program from 2017 till the present, and it's currently wrapping up this year. This program contributed extensively to the validation of our science and products. We participated in Region 5, which includes Iowa, Minnesota, Montana, Nebraska, the Dakotas, and Wyoming, in partnership with Blue Cross Blue Shield Northern Plains Alliance. This pilot allowed for flexible and innovative approaches to the traditional MTM program, focused on patient outcomes and aligned incentives based on achieving a reduction in overall medical costs. If you work in the Medicare area, you understand that the current MTM program is built around identifying patients who are on a large number of medications or have a large number of comorbid conditions. We've identified that although effective, misses a whole group of patients who may have neither a large number of prescriptions or a large number of comorbidities, but take medications that cause adverse events when taken together. And an important part of our science is that we're not identifying medication errors, although that happens as part of the medication reconciliation process. Our science is built around looking for adverse drug events that occur when patients take drugs for the right reason, at the right dose, but when put in the body together at the same time, lead to an adverse drug event. In the EMTM program, there were over 300,000 unique members in the region, 20% of which were identified as high risk for medication-related problems. Over the first 3 years of the program, 59,000 patients were engaged by more than 400 specially trained pharmacists, with a resulting net savings of more than $129 million, mostly attributed to significant reductions in emergency department visits and hospital admissions. Tabula Rasa HealthCare's research and development team recently compiled our insights from the pharmacist-led enhanced MTM model into a 3-article supplement published by the American Journal of Managed Care. Article number 1 reviews the association of healthcare outcomes with the patient's MedWise risk score. Estimations shown are calculated outcomes per unit risk score increases. Additionally, elevated risk scores also increase the risk of ADEs, falls, and mortality. So as you can see from the slide, 1 unit of risk score increases annual costs by 8.5%. It increased emergency department visits by 7% and increased hospital admissions by 3%. The second article discusses the most common medication-related problems identified, most of which are actionable. 82.4% of patients, of intervened patients had identified actionable medication-related problems. The most common problems identified were adverse drug reaction, drug interactions, and drugs used without indication. The most common pharmacist recommendations made from those interventions were to start alternative therapy, discontinue the medication, change the time of administration, or change the dose. And in the third article, patients who completed MedWise safety reviews saw better year-over-year outcomes than those who did not complete a consultation. With a medication safety review, we saw a 7.5% improvement in healthcare cost savings, a 10.3% reduction in hospital admissions, a 10% decrease in emergency department visits, and a 2.1% lower mortality rate than the non-intervention group. When we look at the results in each group, those patients that received a medication safety review, healthcare costs increased by $1,158 average per member. Admissions were 1.3% fewer per 100 patients. Emergency room visits were 1.5 higher per 100 patients, or reduced by 1.5 per 100 patients. And the mortality rate was 6.8%. Those patients without a medication safety review, showed a cost of $2,116 increase per member, as compared with the group that had an MSR of $1,158. Admissions were 2.6 more per 100 patients. Emergency room visits were 7.7 more per 100 visits than the group that had the MSR, and the mortality rate for the non-MSR group was 8.9%. We are glad, I'm glad at this point to take any questions in the chat that you may have. And if not, I will turn it back over to Patrick, and thank you for the time spent today in reviewing our MedWise Science.
Perfect. Thank you very much. Extremely valuable and informative presentation, Brian. We appreciate Tabula Rasa supporting MHPA as a bronze partner. Again, longtime supporters. Keep in mind, everyone, that you can reply to the email you'll receive from Tabula Rasa. If you have any questions and you want to engage in that sort of a private setting, no worries, you can do that there. But for now, thank you again, Brian, and thank you all for joining us this afternoon. Have a great day. Thank you.